cognitive decline scares me to pieces.
I think that many people don't realize that about 2/3 of dogs are affected by dementia by the time they get senior. The most heartbreaking thing is when you come home and your dog doesn't recognize you or is acting confused.
If you stay up all night, you get significant beta amyloid in the brain, but the brain gets rid of it, which is why when you're like 20 years old, you can pull an all-nighter. And if you do that when you're 60, you're not going to recover really well.
So we are here today, everyone, because we are going to be talking about canine cognitive dysfunction, or doggy dementia, which we know it as. And Dr. Laurie McCauley and I are going to be kind of sharing experiences as opposed to one or the other talking. We're just going to have a chat and just kind of try to combine everything together. So we'll be talking about dogs and also humans. We'll be talking about different supplements and herbs. And we'll also be talking about some drugs that are actually affecting cognition and nerve function in our dogs that are actually, from my opinion, quite dangerous. And we'll be also talking about the effect of sex hormones on cognition and nerve function. So we have so much to do. Hi, Laurie. How are you doing today?
Hey, how are you, Peter? It's so good to see you.
Good to see you too. We've kind of become buddies over the months and years we know each other. You know, I always look forward to hanging out with you and also just kind of diving deep and not really knowing exactly where it's going to take us, even though we have a little bit of a plan, actually quite a bit of plan, but you know, at the same time, it always evolves, and that's the best part because it's not really scripted. We are not really preparing for hours and days. We just kind of bring up some topics and then we kind of bring it together. So, you know, do you have any personal experiences with dementia? That sounded actually really bad. I mean, like,
okay, so
I'm gonna before you go, I didn't mean you, but you know, your family or your dogs. Of course, not us, right? It's never gonna happen to us. Just
okay,
kidding.
so Peter, I am a very intellectual person, so cognitive decline scares me to pieces. So I actually study it because I want to do everything I can not to be in that position. And my mom was 92 when she passed, and she would forget things. And it emotionally hurt her, right? I'm so cold, I don't understand this. She forgot how to turn the thermostat up, right? Or things are missing from my apartment. What's missing, Mom? My shorts. Mom, if you told me your bracelet or your ring or something was taken that was expensive, nobody is going to come into your apartment and risk losing their job to steal your shorts.
Exactly.
And it hurt her so much mentally. And I've had a dog, my Rudy, who I adored, that I lost at 15 and a half, who had the osteosarcoma at 12 and a half, that would pace and vocalize at night and go to the wrong side of the door.
Stare at the corner. And
Stare at the corner.
Things,
Yep.
right?
Just, I don't remember who you are. I don't remember. And by doing certain things, we got him comfortable again, right? Which decreased his anxiety, which made his quality of life better.
Yeah, and I think that many people don't realize that about 2/3 of dogs are affected by dementia by the time they get senior, and it's a serious problem. And the most heartbreaking thing is when you come home and your dog doesn't recognize you or is acting confused. And nerve function and brain function, there's so much that we are learning now and how we can positively affect it. And I think that most people kind of understand it to a certain degree, but there's so much confusing information that it also leaves them kind of paralyzed, because once they go online and start Googling and learning about doggy dementia and what they can do, they just go, I can't really do it all. So I think that it's going to be really nice to focus today and just kind of give people the 20% of things and, you know, tools that can make 80% of the difference. We cannot really do it all. We know that we can't do it all.
Right.
So, you know, where are we going to start? Like, I almost feel like we should kind of talk a little bit about what the signs and symptoms of doggy dementias are, even though we kind of touched it by your doggy, but it can present different ways. Like, it can present as confusion, and it can also present as anxiety or aggression or changes in behavior, moodiness, depression, like all that.
Yeah,
What is your
lethargy.
experience with
People
dogs?
say, "Oh, my dog is just getting older." Well, they don't have to be that
Yeah,
way. They can
no.
enjoy life. How old is Pax now?
Paxi is 6. I was just thinking about it today that, I've been obviously on the preventive train for a long time and also with your help, he's doing amazing, but I definitely want to make sure that he's going to be functional. And, when it comes to my overall experience with dementia, my previous dog, Sky, did not have cognitive disorder. He was very sharp border collie until the very end. But I actually had a temporary, in 2013, I was rear-ended and I had a temporary loss of my short-term visual memory.
Oh,
So when I
wow.
needed to copy a number from one side to one page to another, by the time I got to the other page, I actually could not see it. And what actually improved after struggling and, doing different training and so on, and I actually started taking quite high doses of omega-3s. And within pretty much a couple of months, it started going away. And I don't see any remnants or leftovers of that. But it was really hard, seriously hard, because I kind of thought that maybe I was suffering from early signs of dementia, and it wasn't. But brain injury and trauma actually can also lead to these symptoms. So maybe we can start with some of the oils and fats. Like, we can maybe, I know that you love medium chain triglycerides, so why don't just go there? And I'm going to maybe continue with omega-3s and DHA especially. Why don't we just do that?
We can do that. I think short chain fatty acids as well should be mentioned because
That's
that is,
triglycerides, right? Sorry,
yeah.
medium. Did I say medium chain? Sorry, did I say short chain or medium? Like,
You
I don't know.
Are you forgetting, Peter?
Maybe I have to take more omegas today.
But actually both, right? I mean, medium
Yeah,
chain
exactly.
triglycerides, short chain
Yes,
fatty acids,
exactly.
the omega-3s, all of them
Omega-3s.
decrease inflammation and specifically can decrease inflammation in the brain, right? So it makes a
Exactly.
huge difference. Actually, can we, and I know this is your show, but can
No,
we
it's not
start
my
from
show.
the
It's our
beginning?
show. Like, don't say this is
Okay,
my show.
okay.
Come on.
Start from the beginning and explain what's going on in the brain so people
Absolutely.
understand not just, oh, this is what I do, but this is what's happening and this is why I do what I do. Because in my eyes, people are much more likely to do something that they understand more than just something they're told to do.
So maybe I should ask the question, Dr. Laurie,
Yes.
what's happening in the brain when dementia sets in?
Great question. So there's multiple.
We're so non-contrived today. Like, we're super natural.
There's multiple things in both humans and animals. Actually, Alzheimer's and dog dementia, canine cognitive dysfunction or dementia in dogs are very similar. We see micro hemorrhages, right? So little bleeds in both. When we look at research, and I don't want to get into too much of the weeds, but
Just a little bit of the weeds.
it's a little bit of
You know,
weeds because I can't handle it, right? I have to teach, right? There's something called beta amyloid, and beta amyloid is a protein that is made when you're stressed, when you have issues. If you stay up all night, you get significant beta amyloid in the brain, but the brain gets rid of it, which is why when you're like 20 years old, you can pull an all-nighter. And if you do that when you're 60, you're not going to recover really well.
No
As
doggy
we
parties for dogs, that's for sure. Go to bed,
go
doggy.
to bed, hey, 8 o'clock, let's go to bed. So this beta amyloid starts to build up and it creates inflammation. And the more inflammation, the more beta amyloid. So it cycles there. When you have inflammation, you have breakdown of the blood-brain barrier.
Absolutely,
then-
and that's so important, right?
Oh, yeah.
For making sure that the toxins that are supposed to stay in the bloodstream and all the molecules that are not supposed to cross start crossing, because if the blood-brain barrier is actually intact, it will not allow these large molecules to get in. But when they get in and also toxins get in, then the brain gets affected, right? There's more inflammation, as you said, and so on. So anyway, go on.
So I'm even going to back up because there's new research that just fascinated me, and I want to share it with your listeners. I was just like literally a couple weeks ago lecturing at the AVMA, and I listened to Dr. Dewey Curtis, who's a neurologist, neurosurgeon who's been studying this for a very long time. And what he was saying from his research, not just thinking about it, but his research, is that it can start in the mouth. So with oral bacteria and inflammation in the mouth, it leads to a dysbiosis, so gut issues, right, which is one of your specialties, right? Supplements to help the gut be where it needs to be. Because then you have breakdown of the intestinal barrier. So just like the blood-brain barrier, you have an intestinal barrier. And the bad bacteria in the gut goes into the blood and then comes up and damages the blood-brain barrier, which then allows more bad bacteria to come up and cause inflammation in the brain. So yes, we can treat what's going on up here. And if we can prevent it by keeping this clean and the whole GI tract clean, we have a lot less to fight up here.
And this is why it's so important for all of you who are watching to actually give your dogs right type of bones. There is an article on my website about bones and what bones to give and which ones are safe and which ones are not and all that. Because with dental health, as you say, brain health, cardiac health, kidney health, gut health, like, oh my goodness, if you guys don't give your dogs raw bones or look after their teeth, not on once a year basis, but every single day. Have you ever been using like interdental toothbrushes for yourself? Like I know that for dogs it would not be actually as beneficial or useful, but you know, this applies to people as well, right? Like dental health and so on. So
I do. I have a little Christmas tree brush that goes between my teeth. Absolutely. That, and because dental floss doesn't get everything out. And it makes a huge difference.
Yeah. Do you have any favorite brands? Like this is not a sponsored event, but I actually have a favorite brand. I know it because it's actually invented by a Czech person, but it's made in Switzerland. It's called Curaprox. And I could show you actually. I'll show you, okay?
Okay. Would you want me to go get mine?
Yeah, sure.
Okay.
I love your cushy chair. What an amazing chair.
It's fun.
I'm sitting on the kitchen bar stool, kind of like, you know, so it's a little not as comfortable as yours. I have to upgrade.
It's a big comfy chair. And it's a recliner, so I could go way back.
So yeah, recline. Dr. Laurie McCauley. You know, you have so many titles behind your name, but what I actually really love about you, that you're so normal. It's so lovely, actually. Anyway.
Thank you. That's so sweet. I love to learn. The letters are just because I love to learn. And I love to teach.
This is like Dr. Laurie McCauley loves to learn. That's what it is in translation. But it's also standing for rehabilitation and sports medicine specialty, board certified, of course, and other.
Yes. So I'm board certified in sports medicine and rehabilitation, and then certified in canine rehab, acupuncture, chiropractic, and I've taken tons of classes in like craniosacral and myofascial and as many things as osteopathy.
We're born nerds.
Yes,
I think.
Very much a nerd. I love it.
We should actually put NERD behind our name. I don't know whether it'll fit to yours, like it'll fit to mine. I just have DVM, right? So anyway, so this is Curaprox.
Oh, cool.
And they come in different colors. And when I go to my dentist in Prague, like when I have my hygiene appointment, they actually test the different sizes and they tell me, use the green on this in this area and use the red in this area and the yellow and so on. So it's really fun, actually.
Very cool. Yeah, mine, I looked, it's Oral-B and you just have the little brushes and they're shaped like a little Christmas tree.
Yes.
And it gets right between my back teeth and yeah.
And you know, I can actually change. So I can exchange the little bits at the end so I can reuse the handle. But anyway, it's perfect. So we were talking about dementia. We're talking how important dental health is for dementia in dogs and most likely people. We talked about the short.
Can we go? Let's go back to dental for a second.
Yeah.
Right? Because so many people, like in my world, before I knew about this, I knew that there was a syndrome called little dog mouth.
Oh
And
my
what that
goodness.
meant was
I can smell it actually.
you
I
can,
remember it's
yeah.
etched in my brain how bad it is in most dogs actually.
And you have to think with all that tartar. I mean, I've seen dogs where literally it's the tartar that is holding the teeth in the mouth, that it
Yeah.
has to
Yeah.
hurt,
Yeah.
as well as being
The
infected
level of infection, it's
and
crazy.
inflamed. And people don't realize it, that you don't just think about it when your dog stops eating, right? Because it's a survival instinct that they need to eat. So they have to choose between, do I eat and be in pain, or do I not eat? So keeping the mouth clean is huge. I mean, if people have ever had a toothache, right? And that may not be any tartar that you see at all, that keeping the mouth clean is huge.
But you know, many people actually are afraid of the regular dental cleaning under anesthesia, and obviously anesthesia is safe these days, but it's not ideal to put our dogs under,
Right.
you know, every 6 months or so. So I think that people need to understand that there are actually ways of helping your dog's teeth and keeping them healthy without the anesthesia, or, you know, when they reach a certain point and they're really bad, you can't really delay it because you're delaying the dentistry, but you're actually speeding up life itself. So it's not a really good idea. It's a serious problem. I'm going to let you guess. My dog Sky, when he died at the age of 16, had really good teeth. And I was very happy about it and proud of it, even though I had a lot of other things to learn. How many times do you think I put him under anesthesia for dental cleaning?
Knowing you, none.
Because he did not need it. Because when you actually learn how to maintain teeth, you don't need that. But there is
Right.
also a point, like if he built tartar and if he had, you know, subgingival tartar or gingivitis and infection, he'd be out for dental tomorrow. Like there is no doubt in my mind. And people need to understand that. It's like the least of the two evil. Dental cleaning is nothing in comparison leaving passy abscess teeth, right?
Right, right. Can I throw in there how I recommend? Because I had a 24 employee, I had the first rehab clinic ever, right? And it grew and it grew and it grew. And the only non-rehab product we carried was a product, because I saw so many geriatric dogs, that not only prevented tartar, but actually got rid of tartar. Now, it's a long story. It used to be called Vet's Life, and then that company got sold, and then it came back as Core Pet, and I know they were changing the name, but I know it had neem oil in it, and it helped. I know that one TDC, it has beef tallow in it, and that actually helps decrease inflammation and infection in the gums. And I used, there was a chlorophyll product that you put in the water that I used for a while to keep my dog's teeth clean. But same thing, Sid is 8. He has never had his teeth cleaned.
And this
Raw
is the
food.
thing that you never need to ask me whether you can share something, you just share it, because this is how we learn. And, you know, we learn from each other, and then we hopefully pass the information on to others as well. So it's all really fun. Obviously, chlorophyll, amazing antibacterial and kind of cleansing ingredients. It's also good for enriching blood or making the red blood cells and all that. It's actually, did you know that it's just one little bit of a molecule different from hemoglobin? Now I had another, I knew that when we start talking dementia, that it'll have these lapses. We're so tuned into it. Anyway, so it's actually very close to hemoglobin, the molecule of chlorophyll. So where do we go from here? So dental care, we talked short chain fatty acids. Do you want to talk about that?
Just that there's 3 of them, and that, it's not common in a lot of pet foods. There are certain foods that have them in them. Again, I don't know that they're available in Prague. Some of the bigger companies have some of the omega-3s and some of the short chain fatty acids, and those would be like the brain diets, things that are made specifically for cognitive dysfunction.
Oh.
And then I go back to kibble with extra stuff in it, raw food with the enzymes so you don't need the teeth cleaning at least, and, right, there's not one diet that's right for all dogs. right? And there's not one diet, one type of food that's right for all people.
No, I always wonder, though, whether there is any other diet that the diet that nature intended, right? So that's the question. That's the big question with the big question mark. Even though we reach for conveniences, ultimately, I think that dogs are kind of omnivore with carnivorous preference. But yeah, it's interesting. I feed cooked and raw and sometimes very rarely dehydrated. How about you?
My dogs go through everything. So they go on raw, they get dehydrated, they've had gently cooked, they've had, what do you call it, when you slowly boil it? They do get some kibble, I'll be 100% honest. For training, right?
Yeah,
My
yeah.
dog works for every bite he gets, and it's just too hard to feed him his whole meal twice a day from a spoon. So for some of his training, he gets kibble, but it's a high quality kibble.
Yeah. What would I say about that? I respect everyone's differences. I'm obsessed about natural foods, but I also understand that it's convenient and it's good for training. So I also understand why you give high quality kibble. And I love that we have a slightly different opinion because that's what it is about, right? Shall we talk about medium chain fatty acids? Like, shall we kind of tell people how important they are and maybe what foods they're in and so on?
Well, maybe. So I can tell you that, and you may know more about it than I do. I know that medium chain triglycerides, like coconut oil, right, is super, super important. And what its specialty is it can go right through the cell into the mitochondria. And again, this may be over people's heads, but it doesn't have to have something transport it. So L-carnitine takes it in, and the cell can make ATP with it, and it's much easier so it can bring energy about. And it's a great thing. Medium chain triglycerides are great for the skin. They're great for so many things. Cognitive function, absolutely.
I like that he said that it's an energy source for the brain, because as the blood circulation kind of declines a little bit as we age, it's more important for us or for our brain and for doggy brains to receive energy sources that are good, because otherwise, if brain is energy depleted, that also leads to poor performance, memory losses. You can't remember how to say hemoglobin. So, I would not be giving too much of, let's say, coconut oil. I'd just give small amounts, because I've seen some dogs ending up with pancreatic inflammation. But giving small amounts is actually beneficial. Or if you have coconut palms at home, wherever you live, or if you can buy coconuts, it's actually even better to give dogs coconut as a little dessert. That may be a good way to go.
Sid loves coconut. When I can buy the whole coconuts and you want a good laugh, I get a big thing of coconut oil and I take a spoon, and the cats get it, and the dogs get it, and the pigs get it, and the chickens get it. And the chickens love it. They peck at it.
Oh yeah. They just absolutely love it. Chickens are quite smart when it comes to nutrients and what they need and how they choose them. They definitely like earthworms the most. I remember that when I was in the Czech Republic, we used to have a garden and chickens. My spouse's grandma had chickens, and so I used to go and just kind of dig out some earthworms, and they just loved it. Maybe they had some short chain fatty acids too in them.
There you go.
Anything else about medium chain triglycerides?
Oh, that's my knowledge.
There's one thing that I learned fairly recently, that they actually can cause stomach upset, right? And gastrointestinal upset if we give them in large amounts. So that's another part. But I think that when you are, everything in moderation actually kind of goes a long way. I don't really know whether we should touch DHA and omega-3s. Do we want to? There's so many benefits of DHA and omega-3s in general.
We should. We definitely should.
Okay.
And that's your ballpark.
Well, it's actually both of our ballparks. I can start, but once again, I'm very grateful for omega-3s, mainly because they saved my brain basically when I had a car accident. But since then, I use them religiously because I do really believe that they're important not only in anti-inflammatory kind of effect, but also they protect, as we said, the blood-brain barrier, and they also help with cell regeneration, and they're absolutely amazing. And I kind of regret a little bit that when it comes to Feel Good Omega, the product that we formulated is made from squid, that I didn't put higher doses on the label. And I now use about 2 to 3 times higher doses than on the label, because I've seen, and I also have seen the research, I've seen the effect, and I also seen the research. The only thing that I'd say is kind of important, there are a lot of different sources, and fish now is overfished, and it's also high in mercury, and krill is overfished, and some of the other sources that are plant-based are not as complete, and they also are often GMO. So it took me a long time actually to source omegas, and when I found the Norwegian company that actually made squid-based omegas, I got really excited, and I flew to Norway, and at that time, I got also the news that my dog, Sky, was actually, he turned for the worse. He was 16 and I had to fly back and put him down. But at that time, so the Feel Good Omega, not only I have a strong kind of connection with Feel Good because of their medicinal effect, I also remember Feel Good Omega and the sourcing and the story of Sky, and I flew back and cried my whole flight. So omega-3s are super important, not only for brain, but also for the function of the body that you look after, and that is mobility. So have you been using omega-3s and
Oh, absolutely.
them? And what have you seen?
Absolutely. In fact, again, I'm a nerd, so I'm in the research, and there is more research on omega-3s than any other joint supplement, and it's all good. So it's huge both in brain function, like you said, as well as joint and inflammation. I'm going to go into a little bit of inflammation in the brain because I have to. So what happens is we get inflammation in the brain, and then that inflammation actually, because there's only so much room in the brain, it decreases the size of the blood vessels. And then the blood vessels are like, oh, no, don't do that. And it creates more inflammation, and it's this cycle. And omega-3s have the ability to get rid of that inflammation. So it's a huge component in helping with cognitive function. From the research, there's a lot of supplements you can use, and that's one of the really big ones.
It also promotes and maintains vascular health. So if we talked about, decreased blood supply to brain and all that, like when we add omegas, it's undeniable now based on research that they really make a difference. I have a funny story. Do you want a funny story?
I love funny stories.
So, we named our Feel Good Omega because it makes people feel good and dogs feel good. And we kind of like the name, but when we applied for a permit to sell this product in Canada, the doggy supplement went through fine, and it's still called Feel Good Omega. But for the humans, they said that it's too suggestive and that we can't call it Feel Good Omega. So I said, what are we going to call it? I have no idea what we're going to call it. So at the end, we actually decided we were going to call it F Good Omega. So it's called F Good Omega for anyone who wants to check it out. But, why is it F Good? Because it's F Good.
Yeah.
So anyway.
But yeah, like you said, the vasculature in the brain, when they looked at dogs that died from other causes, so not cognitive dysfunction, they found that 53% of them had micro hemorrhages, right? So again, that's little explosions of the blood vessels in the brain that are going to cause inflammation and cause problems. And if you've ever had inflammation in your brain, you're just in a fog. So if you can think about like lack of sleep, lack of hydration, your brain just gets gooey, and then you can't think straight. And that is similar, if not the same, as the feeling that people with cognitive dysfunction have. And by protecting those blood vessels, whether it be with the omega-3s or some of the other supplements, we can decrease those little explosions from happening so that the dogs can stay healthy. Yeah,
absolutely. There's so much that we'd like to go through today. I know that you're a fan of SAMe, S-adenosylmethionine. I don't really even know whether I pronounce it right as an ESL person, but I always have the ESL excuse. So SAMe, let's call it SAMe. It's very familiar.
Yeah, so SAMe is great because it helps support the liver, right? And the liver is what helps detoxify things. So a certain percentage of the blood from every heartbeat go into the liver, and it's our first, well, even from the heart, it comes into the liver, but from the gut, it's the first pass. So before the blood goes from the stomach to the rest of the body, it has to go through the liver, right? And it's going to pull out all the nasty things. And unfortunately, as we get older, it has less ability to pull out all those nasty things. And by supporting it, the liver can pull out the nasty things in the blood so those nasty things don't affect the brain and the rest of our body. So supporting the liver is a way to start to help things.
And I know that it's also part of the neurotransmitter, the medium or the substance that actually helps to transmit nervous impulses into the brain and between nerves and so on, that it actually has a role in that as well. It synthesizes or helps with the production of these neurotransmitters. And also methyl groups. I know that I remember somewhere that I read that it actually provides methyl groups, which are again important in energy metabolism and formation of ATP. So that's an interesting one. But I really like that you outlined the connection with the liver and also just kind of introduce or just give people an idea how everything actually connects with everything, right? Like how interconnected our body and our organs and everything is actually.
It is. I mean, it has to work together.
And I've heard also that SAMe may be actually beneficial for symptoms or arthritis. Besides liver, arthritic pain may be also improved by SAMe, which is actually something that I don't think that we use it as often in medicine with that kind of intention, but it may be actually part of the overall health and longevity plan.
Well, and if you think about it, you think about gout, right? We see that in birds, we see that in humans. That is a form of arthritis associated with the liver not being able to pull things out and having those molecules attaching.
Urate crystals, right?
Urate crystals, right, yep.
That's what happens when you eat too much deer or game meat. I've heard that actually happens. That dogs actually don't have a propensity to gout, but humans do.
Right.
And obviously it's a metabolic disease, right? Like it's not just about eating game meat excessively. I know that many people are really in love with mushrooms. And as a little kid, we used to pick mushrooms. But now it is kind of converted or shifted to medicinal mushrooms and their effect. And there are some mushrooms that can be used in prevention of doggy dementia and human dementia. Do you have a favorite?
I do. Lion's mane is amazing. Lion's mane supports the brain. It can help with seizures. It increases brain-derived neurotrophic factor, which is one of our things that help the prefrontal cortex, which is the front part of the brain, function and do executive function and say, this is what you need to do now and this is what you need to do later. So it helps with not only cognitive dysfunction as you age, but also cognitive function. So yeah, lion's mane, I think, when we talk about the brain, is probably the most important mushroom that we can talk about.
There's also nerve growth factor that actually plays a role, and that.
Yeah, that's right. It increases nerve growth factor.
Yeah, that's that. You were saying neurotropin, and I'm saying nerve growth factor, but it's basically the same thing.
There's brain-derived neurotrophic factor and nerve growth factor.
Nerve growth factor is basically the substance that helps to generate and regenerate nerves, right? Generate new nerves, and also repair nerves. You know, we forgot to mention one thing, how important omega-3s are in babies and puppies, and how deficient puppy foods and baby foods are in omega-3. So that's something that people need to remember as well, because if you have a puppy or a baby that is young, and they don't get enough omega-3s as nature intended, then they may not be developing sufficiently. And then we may have dumb puppies.
Well, and think about children too, right? Children who don't eat fish can have significant problems. And not just in the brain. If you don't get enough omega-3s, it can literally cause heart disease.
Yeah, absolutely. But speaking of fish, like I'm sometimes a little terrified how very little knowledge people have what fish is still okay to eat and which one is not. I know that there are a lot of people who like poke, especially in Hawaii. They all eat poke. And I think they have all clinical mercury poisoning. And there are some, there is like black cod, and there is also what is it called? The fish with the long saw-like.
A swordfish?
Swordfish. That's really high in mercury as well. Not only they're endangered and we should not be really eating them, but they're really not good for us. I actually saw some symptoms of epilepsy that were related to high mercury. I would measure mercury levels in the hair of these dogs, and I saw a correlation between mercury levels and fish diet in dogs. So people need to, everything in moderation, and also when you actually use, let's say, omega-3s that are checked for mercury, that may be a safe way to kind of supplement the most important nutrients in them. But yeah, I do eat fish too. Do you want to know what happened to me just about a week ago?
What?
I keep coming at stories, but I'll pass on the talking stick after that. I went to a restaurant and they were selling wild sockeye nisua salad, like, the salad with eggs and salmon and so on. It's really good. And I was in the restaurant twice, like it's a really kind of like a casual place with friends. And the first time around I was too busy and I was talking and I got the salad and I'm thinking, the salmon doesn't look like wild sockeye. But I kind of left it. And the second time we came, I actually discovered that it was just farm salmon. So I had a big argument with the restaurant owner, who basically told me that I was stupid and I didn't know what I was talking about, and he says, I'm going to bring you the package. So he brought the package and it was like Atlantic salmon. So then we had another discussion about the fact that that Atlantic salmon is always farmed because it's protected species in the wild and we are not allowed to fish it and sell it. So then I was called stupid for the second time around, and it was like a big issue. But warning for people, if you are eating salmon, it's not okay to eat farm salmon for two reasons. It pollutes the water, makes wild salmon sick, and brings disease in the waters. Second, it is not that healthy, and it doesn't really have the omega-3s because it cannot eat the natural food, which is crustaceous, right, and krill. So people need to know that as well, how important it is to kind of be discerning about fish. What is your favorite fish?
Do you really want to know? I don't eat fish.
You don't eat fish?
I don't eat fish. That's why I take my omega-3 fatty acid capsules every day.
It's probably better. The challenge for me is the level of protein. And if we want to age well and be strong, we do need protein. So I do have plant protein. I found this amazing sprouted protein. Do you want to see it? Just recently.
Yeah.
There is another brain food that we forgot to actually mention.
Well, and I do want to come back to fish and metals in them. So can we do that and then go into the plant protein?
Absolutely. I'll put it aside.
So
I'll put it to
hold it
bed.
right there.
We have so much to talk about.
It was, again, I'm a research nerd, so I don't eat fish, and I do love omega-3s. I'm on them every day myself, and my animals are on them. So I was reading an article about the omega-3s, and they were saying that some doctors are saying that if you get other sources of omega-3, they recommend not eating certain fish at all, and others in very little quantities because there's so much heavy metal attached to it. And then the other half of that is that studies that show metalloproteins, which are proteins that have metal attached to it, can damage or do damage the blood-brain barrier. So it's make sure your fish is sourced appropriately if you're going to eat it. Make sure it doesn't have the metals in it, or chelate, right? To take supplements to help get the metal out of your body. And yes, you can hair test to find out if they're in there. Because that in itself, both the metal and the metal itself will damage the brain as well as damage the blood-brain barrier, which will allow the bacteria and all of that to damage the brain.
It's really hard to, like if we go and buy fish, like we can't measure every fish, right? So I think that, fish in moderation, totally agree with you. I think it makes sense that the metal proteins are actually affecting the brain and affecting I didn't really know that, but it's actually nice to learn. And yeah, I think that hair testing is actually really useful. Like I'm always having a hard time to collect enough hair, but I actually, from time to time, I actually get hair key tests done. And it really is nice to know and understand what the heavy metal levels are. And sometimes even checking arsenic and lead and other metals that are toxic. Yeah.
Things like copper, right? You can have a copper toxicity because you have copper in your pipe.
Toxicity comes from eating too much chocolate. I actually had elevated copper some time ago. I don't eat as much. I try to eat organic chocolate, but still. And, arsenic comes from rice. Did you know that it actually comes from rice? Like, I'm very careful about eating too much rice. And there's a problem because brown rice is actually better for you because it has vitamin B in the shell, right? Not in the shell, like the skin of the rice. And the white rice doesn't. But the brown rice has more arsenic than the white rice. And then white rice affects sugar metabolism, and it's not that great for us overall. So I'd say instead of rice, quinoa or maybe cauliflower rice or something like that is actually better. Anyway, we were talking about protein. Can
you grab the bag?
Protein? Yeah, I'll grab the bag again. This is not a sponsored advertising, but I really like this protein. It's called Epic Protein by Sprout Living. And I find it really nice. It doesn't cause digestive issues, and it's organic as well. It has 26 grams of protein in serving, so that's actually quite a bit. And I use that instead of eating our animal friends. Even though I respect everyone who does, I spent too many hours in slaughterhouses during our veterinary school training. Did you go to slaughterhouses in vet school, or did you have to?
We didn't at all.
Yeah, so in Europe, like part of the degree was hygiene of food production. So we actually had to go to slaughterhouses, and that made me really not wanting to eat meat. So yeah, unfortunately.
I eat a lot of eggs, and I have chickens. So I know my chickens are taken care of very well.
Eggs are great, except they contain biotin. And I've heard that it's not that great for guys because it actually may contribute to prostate hyperplasia in older guys. So it's actually, my general approach to aging is actually no sugar right now for two months, or maybe longer. Oh my goodness. And no eggs right now, which is I'm missing, but you have eggs from, in Czech, in my Czech language, we say they're eggs from chickens. Like that means that they're farm eggs or they're home eggs. But it's kind of a funny saying they're eggs from chickens.
Oh, there you go. Creatine. Yeah.
Another brain food, right? They actually have somehow connected it with brain function and preventing dementia. I don't know the background as much about that, but I'd have to read up on it. But I know that it is good for muscle growth and also for the brain.
Yes.
And do you know whether creatine is actually safe for dogs? I actually don't. I have to
When I looked at research, which I'll be honest was years ago, they were saying that it's not metabolized the same way in humans. So in humans, they know that it has a very positive effect. And I think that said 5 milligrams. And I think that's the dose they recommend per day for a human. I don't know if they just didn't have the right dosing or if dogs metabolize it different. They looked into it because they wanted sporting dogs to use it, and they didn't find the effects that they wanted to.
Okay.
Not to say that it doesn't have any, but it wasn't like, oh my God, this is amazing thing. One of the most important things we can do for our dogs is exercise. Exercise is huge in so many ways. It decreases metabolic disease, it decreases musculoskeletal disease, it decreases dementia, it increases blood flow. It decreases inflammation in itself. In itself, it decreases pain associated from osteoarthritis. It actually has been shown to decrease cancer. And there's 2 different kinds of exercise that we want to talk about real quick. One is the go, 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 right? So rats on a wheel actually sprouted more, like 5 times as many, and granted, rats live a lot shorter than humans, 5 times as many neurons, nerve cells in the hippocampus, learning and memory, which is what we talk about with cognitive dysfunction, than the rats that didn't in 7 months. So 5 times as many neurons, right?
Absolutely.
Huge.
Absolutely.
And then the learning exercise where I'm learning how to dance, learning how to step over poles, learning how to balance, all of that stuff increases the life expectancy of each neuron. So by increasing the number of neurons and the lifespan of each neurons, we significantly increase brain power. So that's super huge on both brain and the whole body health span and lifespan.
So before you know it, we'll be dancing on TikToks, right? Learning new. Yeah, and the other thing is that we have to remember that muscles are important in sugar metabolism, and we know that excess sugar actually can hurt the brain. And so having more muscles helps our metabolism. Muscles are the greatest metabolic organ in the body, right? Like they just are super important. And if we don't have enough muscles and our doggies don't have enough muscles, that can cause a lot of problems. And we'll be talking about this later on today, because we'll be talking about hormones and how important they are for maintaining muscles, but also maintaining proper brain function. But before we do that, like I started talking about Librela and the FDI warnings, and because you're an expert, you're a board certified expert in exercise, and you probably see a lot of dogs on these medications. Let's talk about that, and let's talk about the effect and what's happening and what we should do, whether we should even think of these medications or not.
There's ups and downs, right, with every medication. To me, the most important thing is education and patient selection. So if you have a dog that you've tried all the medications and they hurt, and you're like, do I put him to sleep? Is his quality of life gone? I've tried everything. Librela can be a godsend, right? And I know it's going to have some negative side effects, but you know what? If my kid gets hurt and I give him an anti-inflammatory, right? Rest and Rimadyl for our dogs, right? That Rimadyl can have side effects, but in the right instance, it can bring quality of life. Oh, my dog's lame today. Let me take him to the vet. Oh, for $85, I can get a shot and he's going to be wonderful? Absolutely not. It's not a first go-to because the risks greatly outweigh the benefits at that point.
So it's like the, kind of the end stage resort. And I must say that I'm probably a little more orthodox when it comes to that, mainly because I have never needed to use any NSAIDs or medication like this myself or in my own dogs. And thanks to you.
You get lots of exercise.
How to exercise, and we exercise tons, but the right exercise, but also you've taught me how to use laser therapy. And I'd like you to kind of tell people about laser. I know that you use it with mobility, and it's a godsend, absolute amazing. Like I use it every week for Pax and myself just as a preventive, but also for brain. So maybe that's actually something that let's finish the conversation about Librela and then go from there. From what I understand, Librela basically targets the nerve growth factor to relieve pain.
Yeah, it's an antibody for nerve growth factor.
Exactly. So, if that is the case, based on the reports from FDA, it can actually affect it doesn't selectively affect only certain areas that are inflamed and painful. It affects the whole body. And based on what they were reporting at the FDA and the reports that we are getting, and I'd like you to tell me what you think, there are symptoms of confusion and dementia-like symptoms and wobbly gait and irregular gait and also behavior changes, which kind of tells me that there is like a hidden neurological effect of this medication. And I personally would really ask myself whether this is something I want to give to a dog, even if they are kind of in their late stage of life. Like, is it really something that I would like to give my dog or not? Like, I'd be hard pressed to actually use it, mainly because I'm seeing these changes, and I would beat myself up and I would not be able to live with myself if my dog started to get worse on that level. And life doesn't go forever. So, yeah.
So let's think about cancer for a second. If your dog had cancer, you would have to decide, do I want to give him a chemotherapeutic drug? Knowing that chemotherapeutic drug can destroy some of the bone marrow or have a lot of side effects. Humans lose their hair, right? So in many drugs, there's a balance. What we know about Librela, it's an antibody for nerve growth factor. And the idea why the company put it out was because in severe arthritis, by using it, it stops the nerves that are around the joints from being able to grow and send messages to the brain, right? So it decreases the pain. And for those guys, it can be a wonder drug. And they've shown that dogs who don't have severe arthritis and they're given it have significantly more neurological issues. It's almost like, hey, the antibodies are here. No, oh wait, there's no arthritis. Let's go to the brain, right? There's that kind of thing. There's also my dog's had a brain hemorrhage. My dog has a non-firm blood-brain barrier. My dog has ataxia. Something's wrong with his spinal cord and he's walking wobbly. And the body's trying really hard to fix it. And these antibodies, they come in and they just take them out, right? So the body can't recover. And what the company did was when they did their safety trials, they excluded any dogs with any neurological issues. And when it came to in Europe, in the EU, certainly in England, they had warnings on the little insert that came in that said, do not use in dogs with neurological issues.
Absolutely.
When they came to the US, they did not include that.
I see. I didn't know that. I thought that the warning was always or has always been there. So
no, not in the US. Not in the US. And in fact, well, if you read through the insert, it talks about different receptors. And there's two different receptors that they kind of make into one, which isn't real. It's not quite accurate what they have. And when they marketed it, they gave all of the positives and they didn't help people understand that this is a salvage procedure, not a go-to procedure. And because of that, there were a lot more side effects. I think if veterinarians had known from the beginning what the side effects were and had better choosing cases, there would have been a lot less deaths, a lot less paralysis, a lot less cognitive dysfunction. There's a rapid cognitive dysfunction that they see in some dogs with Librela that is significantly higher. Crazy enough, when they look at age range in dogs that are 12 to 13 years of age, so there's less after that and there's less before that, and specifically higher in dogs that don't have radiographic arthritis. So it is not a go-to.
Yeah, I think it's really important to know that this is the last resort. And I started talking about your laser therapy course for dog lovers, for very important dog lovers, VIDP. And can you tell me a little bit about it? Can you tell everyone a little bit about it? And maybe we just kind of do it. I know that this is a cognitive disorder kind of couple of hours, but I know that people will want to know like how to address arthritis and dogs being stiff and painful and just kind of, or maybe just kind of summarize where they can get the information, and maybe we can give them a little bit of a hand with that.
Yeah, absolutely. So if your dog has arthritis and you want to help them at home, there are certainly some really good lasers that you get what you pay for, right? 100%. If you buy something cheap from China, either the diodes are not going to work well, you're not going to know. They turn on and then shut off and you don't know that they're off because they still have a little light. But with the good units, they can help tremendously. And I always tell people 70 to 80% of my clients have lasers, and 100% of them that have it use it on their dog and themselves, right? Because we do, right? And my course was designed because my clients that had them, a lot of them had them, and 0 of them knew how to use it appropriately. So we created the at-home laser therapy course, and it covers all the joints. So from the shoulders to the toes, to the hips, to the spine, to the neck, the pelvis, all of the joints everywhere. And because we're talking about cognition, I have to take it one step further. So the course is all about the joints. It is amazing. It would teach you so much on how to laser the joints and why, so that you have the best effect no matter what laser you use. And I can't not tell that there is research done both on humans and animals using the laser to stimulate the hippocampus. And actually, I was just listening to Andrew Huberman, who is using a TMS, so not a laser, it's a PEMF device, but they're also finding that treating the prefrontal cortex, the lateral dorsal prefrontal cortex. So up here with PEMF, again, is helping with cognition and those kinds of issues.
Now, can you explain to people what PEMF stands
Yes.
for? Because some people will not know.
PEMF is pulsed electromagnetic field therapy.
Thank you. Thank you.
Yes.
That's
So there's different devices. Respond have beds. Assisi has beds. There's Permaflux. There's Recovery RX. There's lots of different units out there, and they do different things. But I love the fact that we're doing more and more research to find out how we can help with non-invasive, non-drug that can have side effects to help our dogs.
If you have anyone at home who has changes in behavior, you just laser their brain. It's going to be all fine.
Well, and we say that. I know practitioners who use the laser at the back of the head. For my vets who are listening, the foramen magnum, right? The back of the head, and aim it up into the brainstem. And it has helped with aggressive dogs at animal shelters, right? Decreasing inflammation
Wow.
in the brain. There's studies in humans that using it on F4, which is up here, again, at the prefrontal cortex going in toward the limbic system, that it decreases anxiety and depression. Like statistically significant changes.
Yes.
I really wish we could do that more for our humans.
Yeah, it's also exciting. So when it comes to mobility and inflammation, it even like connects to each other, right? Like if there's more inflammation in the joints, there's more inflammation in the brain. It seems like there's more inflammation generally, period. There's, it affects the brain.
Yeah.
We talked about omegas. One of the greatest gratitude I have is that I have somehow been so curious and so nosy that many years back, I actually discovered the power of fermentation and two-stage fermentation in making supplements. Fermentation is actually another way of actually extracting the goodness from food and making it more bioavailable about 7 to 10 times. So besides using Feel Good Omega, which I have here, I've been also using in Pax's recovery when he was getting injured. I formulated a supplement for him. It's actually called joint powder. That's 13 different ingredients, including glucosamine and chondroitin, but also pernamuscle and some other ingredients that are turmeric and other ingredients that are really helpful. But fermenting the supplements is actually, it has really expanded my understanding of what fermentation does, and that the body gets help with not only the digestion and bioavailability, but there are like hundreds of beneficial compounds and postbiotics and antioxidants and other ingredients and compounds that are generated from that. So I take joint butter, which is joint and mobility support for humans, and joint powders for dogs. We actually had it in olive/coconut oil base, because I thought, this is gonna be the best for dogs and they will like it. But many dogs actually didn't like it as much. So then we had our community voting, and they said, we want the powder. And I go, oh my goodness, powder again. But it's powder, but it's pretty much the same ingredients otherwise. So I hope that you guys don't mind
Right,
that
my
I
boy.
did kind of introduce you to. Oh, thank you.
Yeah.
But I think that I always, I'm somewhere on the fence when it comes to kind of introducing our community to new things. And at the same time, I know that if you and I talk about problems, and then we don't give them, let's say, the understanding that there's laser therapy that they can use, or that there are supplements that they can use, then we just kind of bitch and complain about the problems, but don't give any solutions.
Tell me, in your joint butter and in your joint powder, what of the things that we discussed are in there? Or what things are in there that could help the brain?
As much as I understand, the ingredients that are in it are not as brain focused, right? It's more joint and mobility focused, which indirectly affects the brain. I can read the ingredients if you want, because if I try to remember 13, you're gonna. So it's glucosamine, pernamuscle, which is a natural
Omega-3.
source of omega-3s, but also natural source of glucosamine. Chondroitin sulfate, then boswellia, which we know is very
anti-inflammatory.
beneficial as
That's
well.
a LOX5 inhibitor.
Turmeric root.
And anti-inflammatory.
Ginger root, again, anti-inflammatory. Sting nettle, again, modifying the immune system and helping inflammation. Vitamin C, again, fermented. And barley grass, just kind of reducing improving the pH and blood cleansing as well. And then quercetin, rutin, and black pepper. So we actually combined turmeric and black pepper together because we know that turmeric is potentiated. It's a synergistic effect when it comes to that. So
So there's a lot of things that help with inflammation in there that may have been formulated for the joint and will help the whole body, including the brain.
And Pax is barking and saying yes. I think that the way we see medicine is very similar because we don't really like this for that as much as if you keep the body healthy, if you keep it toxin free, if you provide the essential nutrients and then maybe some specific nutrients and then align the spine and help the muscles and help the spine and do all that the body actually has a better ability to recover. And it sometimes drives me crazy that people say, I want this for that. And I go, well, it's almost like there is a universal healing principle that you can apply and it helps many things, 80% of the issues that we have, right?
Right. In my head, it's like saying, I want the earth. Oh, wait, I don't want the whole earth. I just want New York City. Oh, wait, with New York City, you have to have LA? Oh, what about Bangkok? What about India, right? It's all connected. It's not like...
It's like synergy, Sometimes people ask me, so what is more important? And I go, well, imagine that you're about to fly, you're sitting at the gate and you see your plane. Like, do you need the engines or the wing or the wings or wheels or the windows? Like, I'm sorry, you need it all. The body needs it all to be healthy. And that's one of the challenging parts because it can sometimes people see it as costly. Like I sometimes see people not wanting to really invest in health and then they pay thousands and tens of thousands of dollars for problems that could have been prevented. And it's really heartbreaking.
And I tell people the same thing, you pay now or you pay later. And if you pay later, the dog hurts because of it.
But at least we've done all we could. And that's something that is worth something. Anyway, I know that we've been talking forever, but we have one more topic to talk about, and that's hormones and the effect of spaying and neutering on cognition. And there is a lot of research in humans, what happens to men in andropause when they stop producing sufficient amount of testosterone and also menopause. And we know that it affects brain health. And maybe I'd like to actually engage you in the conversation and see how you see it, because I've been talking about hormone-sparing spay and vasectomies for a long time now. The World Small Animal Veterinary Association is saying that it's not good anymore to conventionally spay and neuter dogs, and there are some other methods that prevent overpopulation and spare the hormones as well. But you were talking about muscle loss and we talk about brain health and all that. And it's super important to have the hormones as a metabolic booster, right? Like it's like the jet engine without the fuel, like it's not going to fly.
No, I agree. And I can tell you that I love to learn. So anytime I'm driving, I'm always learning, right? Either an audiobook or a podcast. And both Andrew Huberman and Peter Attia, who are both Stanford doctors, who I greatly respect, have both recently been talking about, in humans, again, not in dogs, but tissue is tissue, talk about hormone replacement therapy. And again, in humans, so many doctors read misinterpreted information about in women that hormone replacement therapy would cause breast cancer. And that when they re-looked at it, they're like, yeah, no. And there's zero increase in mortality. And there's so many benefits and it's so helpful. And the same thing with men, that doing a testosterone replacement can help so many with brain function, with body, with so many parts of their life that, I'm not a human doctor, right? And I'm hoping that the information that we're hearing from these leaders in the medical field will turn into information that's continuing to come into the animal field to help our dogs.
I can't agree more. And I feel very grateful that we have the information from human doctors, but there is more information coming through. Discovering Dr. Michelle Kutzler and Parsemus Parsemus Foundation, parsemus.org, have done some research studies, discovered that luteinizing hormone elevates after spaying and neutering, and it causes inflammatory changes, not only in muscles and thyroid gland and ligaments, which leads to injuries and Pax. Actually, my dog Pax was one of those dogs that actually suffered from that before he was put on HRT, but also it affects the brain. And they have confirmed that sex hormones metabolically improve and support the nerve growth. They actually act beneficially against nerve degeneration. They also help to produce or help the metabolism of neurotransmitters. If we lose estrogen and testosterone, it really accelerates age-related brain dysfunction, and that is without a doubt. And now we're at the point where we kind of know how to do hormone replacement therapy in males to a certain degree. The methods are effective and we've seen them work really well. My dog has been lameness-free and happy as ever for a year and a half, also with your help, but also with HRT.
Yeah.
With females, there's still a little bit of a debate. Do we supplement estrogens only or estrogens and testosterone? Testosterone is actually overdose. It can turn into estrogen, which is so weird. So you also have to kind of like apply the minimal doses to get the positive effect without the side effects. But overall, it's so exciting. And our dear friend, Dr. Karen Becker, and I have been recording this program on hormone-sparing sterilization and hormone replacement therapy and just kind of bringing more information to the world. And there are other people involved, Dr. Ruth Roberts and Dr. Linda Brent and Michelle Kutzler. And I know that you're a big supporter because when it comes to rehabilitation, we need the muscles, we need the brain function, nerve function. So it's not far from me either.
And again, to jump in for the muscle part of it, there is significant research that shows that dogs that are spayed and neuter, especially if they're spayed and neuter early, significantly increases their chance of tearing their cranial cruciate ligament. And right now, 30 years ago, it was occasional. Now it is 50 to 80%, depending upon which orthopedic surgeon you see, 50 to 80% of all of the surgeries they do are repairing this ligament. And I will tell you, Sid is neutered because he was neutered when I got him. We got Magic when she was 6 weeks old, and she was a year in April, and she is still intact and will stay that way as long as possible.
In females, there is about 25% risk of pyometra. So some people recommend removing the uterus at a certain point of life, like it usually doesn't happen for any younger females. So there's still so much to learn, but I've never been more excited about medicine than now. It's just kind of bizarre. Like, how long has it been since you graduated?
I graduated in 92, so 33 years ago. We're the wise ones. We could say we're the dinosaurs, but let's change it to we're the wise ones.
I'd like to say that we're eternally curious, and I love that about you. I always love this chatter that we have, and this has been the longest that we ever run. Only an hour and 20 minutes, we're still pretty good. Like in comparison with Rogan and all these people, oh my goodness, it's a mini podcast now. But yeah, I'm very grateful that we got together, and this is our program. This is not my program, and I'm so glad that we've done this together. And we're planning more, right? Like this is not our last conversation. Okay.
I always love my conversations with you, Peter. I think you're amazing. You're so smart.
Oh no, it's your reflection, dear. Sending you a big hug.
Same here. Big hugs.
Give Sydney a hug as well for me.
Yeah.
Is it Sydney or Sid?
It's actually Obsidian because he's a black dog and he's got white on his chin and his little bits on his belly and his tail. So he's like a snowflake Obsidian. And in the sun, he's brown on the sides like a rainbow Obsidian. So he's like my little stone dog. I love him.
I should show you Paxi. He's got his hair coat and everything is just so good now. He's just like a transformed dog. I'll bring him just a second.
Yeah.
He's saying, I don't know what you're doing. Oh my goodness.
Oh my God,
look
he's
at
so
him.
gorgeous.
Mwah.
He's so
He's a
handsome.
little nerdy, but he's so sweet. And it's just been the best thing that ever happened to us to actually get him. And then he coming with this lesson that has been so useful for so many. So
I truly believe that each dog we have teaches us many things.
Yeah. Do you have Sid around somewhere where we can say hi to each other?
I'll go find him. He's somewhere. I think he's outside.
Oh my goodness. You're so good. You're such a good puppy. Yeah, I just went for a moment.
Sitting in the chair across from me. I didn't even see him. Come on, hop.
Oh, look
Oh,
at
aren't you
that.
going to come say hi? Where's
my
my boy?
goodness.
Oh, there he is. There he is. That's right. Can you say hi? Say
Wow,
hi.
look at that. I think Pax wants to go, but I love seeing him.
Love you.
I love seeing him. Perfect.
He's my
So
good
now
boy.
everyone, you know our doggies as well.
Yes.
Our teachers, our guides. There you
Yes.
go. Laurie,
Absolutely.
take care.
All right. So good seeing you, Peter. Thanks for having me on.
Thank you. Thanks for having me on too.